Good afternoon, everybody, and welcome to Project SCoviD. I am your host, Tristan Lee. I am a sickle cell warrior from Pennsylvania with type SS, and today we will be talking to Dr. Ketchy Izirim, aka Dr. Ketchy. Dr. Ketchy identifies as Nigerian American and is a board certified OBGYN and fellow in maternity and fetal medicine. She trained at Mount Sinai in Chicago and worked in Virginia, as well as an assistant professor at a medical school in Texas. Dr. Ketchy currently works in Pennsylvania, actually where I'm from. So let's catch up with her and see how she is. Dr. Ketchy, I see you in the chat. I'm gonna add you. And I hope everybody's Friday is going well. We're just gonna wait for Dr. Ketchy. Is. Hello.
Hi, Tristan. How are you?
I'm doing good. How are you?
I'm good. I'm well. Thank you. Nice to meet you.
Yes, I'm so excited to meet you. And I just wanted to take the time real quick to did I pronounce your name correctly?
Yes, you did.
Oh, perfect. I was like really practicing. So I was like, I just really hope I got like it right. So I'm so glad to hear that. And I love your hat. Oh my gosh, it's amazing.
Thank you. Thank you.
So I hear that you work in Pennsylvania right now.
I do. Yes, yes.
Nice. Yeah, I'm actually from Williamsport. I don't know if you know where that is,
I've heard
but
about it. Yeah.
yeah, Williamsport's a little tiny city, just like outside of everything. Like we're 3 hours away from like Philly, we're 3 hours away from New York, we're like 4 hours away from Pittsburgh. So like we're
Oh,
kind of
wow.
like in that hub area. But yeah, it just excited me when I saw that you were in Pennsylvania. That's so cool. So
Yeah.
now,
Yeah, I'm actually in Harrisburg, Pennsylvania. It's a nice, cool little city. It's not bad at all.
oh yeah, like Harrisburg is one of my stomping grounds. So like that's
Really?
exciting. Yes. So let's get into the talk. Can you tell us a little bit about your vaccine experience?
Oh my God, you're gonna ask. So first of all, I'm deathly scared of needles.
I understand.
I know that people are like, how can you be your doctor, your surgeon? How are you scared of needles? But yeah, so it took a little like mind over body situation, where I'm like, I can do this. And a long time really for me to actually go get my vaccination. But when I finally got there, or
Mhm.
got around to getting it done, it wasn't terrible at all. It was a very tiny needle. I was like, you done? So
Right?
yeah. But otherwise, it was great. I left there. I was fine. The next day, I went swimming. I didn't have any unusual symptoms or anything like that. And here I am. So it was
Nice.
great. You almost forget you've done it because it's almost like an insignificant part of life,
Right.
just, but, very vital still.
Oh, definitely. Yeah, like I was the same way. Like it was like quick, easy done. And I was just like, oh, that was it? Okay.
Yeah.
Like when I get my procedures done for like my sickle cell care, like the needles are way more extreme. So I'm like,
Oh,
oh, that
yeah.
was nothing. So I
Yeah.
just like wiped my brow and just like continued to go on with my day, like you said. But
Yeah.
yeah, I'm glad that you had like a great experience. So what can you tell us about current guidelines as far as COVID-19 vaccines and pregnancy and fertility? And
Mhm.
especially when it comes to, is it different like for sickle cell warriors, do you think?
So I'm going to answer that question stepwise. So as far as COVID vaccine and guidelines and pregnancy, we recommend it. So in obstetrics and gynecology, there are basically two colleges. Well, actually one college, College of Obstetrics, College of Obstetricians and Gynecologists, and then there is the Society for Maternal Fetal Medicine. The society is basically a group, a station for the high risk doctors, the high, perinatologists and things like that. So these
Mhm.
two bodies have recommended are recommending, and we are all going by that, which is in support to the CDC. It is safe. We have not, as far as this research we have done so far, we have not seen any adverse effects or any contraindications to pregnancy nor to the baby. Okay, what we have found actually, because pregnancy itself is considered an independent risk factor to having severe COVID.
Okay.
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 So now the thing is, so it's not just that. So imagine now we have a woman who's 35 years old. Maybe she's obese as well, right? And then she's pregnant. Now she has 3 risk factors for having severe COVID. Severe COVID is basically where you get so sick you have to get into the hospital or actually the ICU, right? So now
Right.
she has 3 risk factors, of which pregnancy is an independent one by itself. So for that reason, because that means that pregnant women have a higher chance of being sicker and having to get into the ICUs and get management, and that course by itself, as far as when you get to the ICU, all that has to be done. The effects of pregnancy on your own recovery is one of the reasons why we recommend that all pregnant women get it. Okay,
Okay.
or even if you're considering pregnancy at any point during your pregnancy, so first trimester, second trimester, third trimester, it is safe as much as we know. So there is no reason why you should not. As far as COVID vaccine and fertility, we have not seen any contraindications. We haven't seen where the COVID vaccine is affecting or reducing fertility. Okay.
Okay.
We are
Okay.
obese, so we haven't seen it affect fertility for the women, and I'm not aware of any studies that have seen it affect fertility for the men. Okay,
Okay.
so all of those, they're all, I don't want myth speculations, but there isn't any evidence whatsoever that contradicts or that implies that COVID vaccine increases or reduces fertility in any way. So for that, we recommend for those who are trying to conceive or going through the process of fertility or assisted reproductive therapy. Then as far as sickle cell disease, how COVID vaccination is different. I think that was the third part of the question, right? The only difference is that because you have sickle cell disease, your
Mhm.
immune system is reduced, okay? And depending on where exactly you were with the condition, you may be needing to take immunosuppressive medications like hydroxyurea, right?
Yep.
Right. So that makes you a higher risk population as well. So for patients like that, we recommend an additional dose of the COVID vaccine.
Okay.
So
Okay.
that's where it's a little different for as far as sickle cell disease or any other chronic conditions that might reduce your immune system.
Okay. Yeah, because like I actually have a friend of mine, she's about to give birth next month. And she got the Pfizer vaccine like I think back in February, or it was around the same time I got mine. And so I know that was like important for her to hear. So thank you for answering that. And then as well, about the second or the third dose, because I got both doses, of course. And now, I'm coming up to the point where I need to get my third dose here in October. So I just talked to my hematologist actually last week, and I was like, do you think I should, schedule my appointment for my third vaccine? And she was like, yes, like it's very important. So I'm glad that you answered that question as well.
Yes.
So just thank you so much. Now, how has this pandemic in hospital treatment for people with sickle cell disease who are pregnant or trying to become pregnant, like how does this pandemic like work out for them, do you think?
Yeah, so as far as, well, at the initial stages of COVID, right, last year when it all started, there was that stay-at-home order. So basically what we did was we only brought in patients. Well, for me, what I did in clinic then was I canceled all my GYN patients, gynecological patients, because there are hardly any emergencies with them. But then would let our obstetric, the pregnant girls, come in to see us. So that was how that affected it initially. So given now with the vaccinations, we have, of course, reduce the number of people that can come to your visits and things like that. So those were the little changes, but we have stuck with those changes to a large extent just to reduce the risk of infection or, contamination, not contamination, cross infections and things like that. Now, as far as But still, so as far as if a person has COVID by way of, or they had been tested for COVID and became positive, the question will now be, are you symptomatic? That means, are you having difficulty breathing? Are you breathing fast? Do you have a fever and things like that? So we make these conversations over the phone because we do not want to bring you into our office or, where you see other pregnant women and increase the risk of them getting it. And then based on that, we'll either triage you to stay home and tell you what to do, and the nurse will check in with you every now and again until you become moderately sick, whereby you're having more difficulty breathing or just your fever is not going away with Tylenol. Then we'll bring you into the hospital. So with that, where I'm currently working, what we have done is we have like 2 rooms set out for just COVID patients on labor and delivery floor. Okay. Prior to us setting up that room, we had been managing our patients in the ICU floor. Okay. But in this room now that we have, so where we can basically do everything but intubate, we'll keep the patients there. It's like a closed unit whereby it doesn't allow air to leave that room and go to the entire hospital, so it's a particular room, just to reduce, again, risk of contamination or infection. So we then manage the patients there while we are also collaborating with the critical care doctors in the ICU. So in that regard, it hasn't really, it's more critical because with pregnancy, where ordinarily, if you're not pregnant, we'll say, okay, fine, let's get your oxygen level to 90 or something when you're not pregnant. In pregnancy, because there is a baby involved, we need you to have more oxygen. So our own minimal that we can tolerate is 94%. So if we cannot, so we'll keep in giving you oxygen, right? By whatever we have in the hospital. If we cannot maintain you at 94% on that floor, then we'll transfer you to the ICU. And at that point, we'll start to have conversation as far as should they intubate you, what else needs to happen. In all of this, we're also considering how far along pregnancy that you are, because then again, the question will be, should we just deliver her? And then, things like that. But the other thing is that if you're going to deliver a patient who is sick with COVID, how are you going to deliver the patient? C-section?
Right.
Because she's still sick, she's not going to push for you. So it's not a vaginal delivery, it has to be a C-section. So now, how sick is she that if I cut her open, I can close her back safely without increasing or worsening the infection?
Oh,
So
wow.
so these are the things, how it basically affects the decision as far as the management of COVID in pregnancy, because at every point, we're always considering the babies.
Yeah.
Yeah.
Oh, well, like that, you know what? You just dropped like a lot of gems. And I just want to go back to that point that you said about, how you have the sealed off room and it's like a airtight vacuum seal. So like, those patients are basically segregated from like everybody else. So like there's no cross contamination and there's no risk. So thank you for like explaining that and how exactly how the safety of the hospital is. Like I just think that puts a lot of people's mind at ease. And I love that you answered the question about like, the mom and the baby and like the C-section. Like my hats go off to you and your practice, because I just feel like a lot of times, especially with like OBGYN and when it comes to especially like Black women, you know what I mean? I know they want the safest and most effective treatment for them and their baby coming into this world. So I just thank you for that so much. Like that was a great explanation. Now, what concerns do you hear from your patients about COVID-19 vaccines, and how do you address them usually?
Well, the concern is always, the political concern as far as, well, it's not a political concern, the political conspiracy theory or whatever that is, as far as, 5G, let's not do that. But,
Right.
So usually the concerns I get is as far as, they don't believe, some people don't still believe that there is something like that. But the more concerns we have as far as those who have an open mind, at least who are having the conversation, is, will it harm my baby? Because every pregnant woman wants to do the right thing by herself and especially by her baby. And so in situations like those are valid questions because and that's what we talk about for every single medication or for every single vaccination or for every single treatment we're giving in OB. How does it affect the baby? So what we do, how I address those concerns, I give you the data and the facts based on what we know. And I'm saying this based on what we know, not to say that we don't know a lot, but the thing about science or real science is that you cannot know absolutely. Like if you think science is an absolute, then you don't know science.
Yeah.
Because the more you know, the more you realize that you really don't know, or the more you know that, oh, there is so much more I need to know, hence research, hence evidence-based medicine. So as far as what I give the data based on what we know and what the research studies have shown, that the vaccination has increased the risk of the antibody that you pass on to the baby. Okay, and we all know that antibodies is very good for the baby because once the baby is delivered, you are his or her only source of protection by way of what you have given him during pregnancy or what you're continuing to give him or her through breastfeeding. Okay, so in that point, so there are still ongoing research as far as how much vaccination, not vaccination, how much antibody, because the point of vaccination is to produce antibodies to protect you initially, right? Now, the question is how much antibody protecting you can also get to the baby to protect the babies. Okay, so those are the kind of information that I give when I present data, actual data from science that has been done. So that what we have seen, we haven't seen any babies that have been harmed by the vaccination. What we have seen is that the babies in the cord blood had antibodies that were produced because the mother had a vaccination or that she had an infection, okay? But the question now is how much antibodies can we get? What we have seen so far is that the longer the time between the interval between when you had the vaccination and when you delivered, increase the number of antibody that a baby would have. Hence, by inference, means more protection to a large extent, putting it simply. Things like that. Yeah. But the other thing as far as those questions are concerned is that when you look at it from a human perspective, sometimes they are emotional questions that they have. And in answering these things without you getting your own also emotional, you can almost have a logical conversation to a large extent with most people. So that's basically how I address those.
Okay. Well, thank you so much. Do you have time for one more question?
I do.
Okay, cool. So the last question is, what is your best advice for a sickle cell warrior who are hesitant to get vaccinated, especially those who are pregnant or hoping to become pregnant?
What I would say is, please, honey, get vaccinated, okay?
Yes.
Get vaccinated, get vaccinated, get vaccinated. And
Yes.
it's not because it's the trend in town or because I'm obliged to say it, no, right? Because when you're pregnant, first of all, when you have sickle cell disease, your risk, basically almost every single day is a fight for you, okay? Then when you become pregnant, the risk increases because now you're having to produce blood or you're needing to make blood not just for your own survival but for the pregnancy to survive, right? You may also, then what happens when you have crisis? Infections will increase the risk of you having crisis, right? Then you're in the hospital. So why would you add one more risk of another infection to the pregnancy that is already complicated? Now, as far as those who have sickle cell disease who are trying to get pregnant, like I said earlier, there is no reason. It doesn't count against you in any way. It doesn't offer any adverse effects to you or the journey to fertility. It just, keeps you healthier to continue the fight. So get vaccinated, please. We all need it.
Yes, thank you so much. I'm going to take one question from the comment section, and I think it's for you, Dr. Ketchy. So it says, let me see if I can find it. Okay. It says, Dr. Ketchy, do you think this pandemic is ever going to leave permanently? And do you think it has changed anything major in the healthcare line or system?
Do I think it would stay or leave permanently? Honey, we all want to know. You know, I guess the thing is, it depends on how much control we can get or how much progress we can make with vaccination, or at least getting people to wear their masks as well.
Right,
Because
right,
if you think of any pandemic, right, they always say herd immunity. It's not just about the herd immunity, it's about let there be a massive effort towards doing one thing. So it takes longer to get to that point if less and less people are getting involved in the fight. So that's how that is as far as, so the sooner we can get on with it, the sooner we can maybe see an end to it. It's almost like smallpox, right? Some countries got a better handle of smallpox above other countries or earlier than other countries. It's just like Ebola. So it's just how quickly we can control things that we can control, that we can get to a point of resolution faster. Now, as far as has he changed things in the health system? Oh, yes, it has. It has. Yes, 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 yes. And some for the good, right? Because what I think, from my perspective, is that it has basically shown us how strong we are and also our flaws. Okay? Because
definitely.
take for instance, it made the disparity in healthcare more obvious. Okay, it made it more glaring. Whereby Blacks, Hispanics, or Latinos, right, have a
Right.
poorer outcome. So if anything, it has brought to light the need to have these conversations. Okay. On the other hand, too, one of the, like I said, it has made us stronger because now we have seen how together, when we all stand together, we can fight and withhold things. I have seen, the team's effort that has gone in between doctors, nurses, nurse practitioners, and even down to the janitors and down to the housekeeping. It's amazing to watch, right? So those kind of things, it just gives you hope that the next day you still show up to work despite the risk that you might be facing. But in terms of the flaws, as like I said, it has emphasized the social determinants that can affect healthcare. How quickly can they access healthcare? When they get there, what happens and why are they being treated this way? Things like that. So yes, it has changed healthcare. Hopefully, we would learn from what we have seen or what it has exposed about the systems that we have in place.
Yeah, definitely. And even like I know for me on the patient side of things, like I always, and this is weird when I say this, but like I've always kind of felt safe in the hospital. But now like after going through all this and seeing all the precautions that the hospitals are taking, like I feel very comfortable, even more so, you know what I mean? Because I see the constant cleaning, I see the kind of behind the scenes as a patient of like everything that's happening, like from the wiping down after somebody like leaves the seat and all that stuff, or you know what I mean? I just see it. So I think that we are definitely going in the right direction, but you are so right. Like we just need to continue to wear our mask, and we need to continue to definitely do the hand washing, and just continue to, trust the vaccine, trust that, the doctors and the scientists know what they're talking about, and just, come back together as a world and end this pandemic as a whole sooner than later.
Yeah.
So I just thank you so much for your time today, Dr. Ketchy. I know we kind of went over, but I feel like we answered a lot of great questions. I'm so happy to make your acquaintance, and I hope that this is not the first time, or I hope this is not the last time that, we get to talk. And can you just tell people where they can, find you, like on social media, or if they have any other questions, like do you have an email or?
Yes, I do. Well, first, let me say thank you so much for having me. It was my pleasure being here. Thank you for the opportunity to talk about this because, maternal mortality or maternal care is very dear to my heart. So thank you for that.
No problem. Thank you.
I am on social media. Believe it or not, I only just joined Instagram about 3 months ago. So I'm on Instagram as Dr. Ketchy, at Dr. Ketchy.
Okay.
I'm also on Facebook with the same handle.
Okay.
What else? So as far as email, yes, anybody can reach me through any of those. DM me. My phone number is actually on my Instagram page if you want to have a conversation. On the other hand, also my email address is also on my Instagram page and also my Facebook page. So I'm not hiding.
Okay.
It's a well-connected world, so you always find me. But yes, at Dr. Ketchy.
Nice. Well, I will definitely be friend requesting you sooner than later. Thank you again so much for your time, Dr. Ketchy.
Thank
And
you.
I hope that you have a great weekend and just continue to live well and stay safe and healthy.
Thank you so much. Thank you. You too.
All right. I'll see you later.
All right. Bye.
Bye. All right, everyone. That was today's Project SCoviD, excuse me. And that was Dr. Ketchy, the amazing OBGYN. We thank her so much for everything that she's doing and answering all those questions. As she said, you guys can find her on social media at all those handles. And just continue to tune in every Friday at 4 p.m. to Project SCoviD, as we will continue to have these important talks, answer your questions, and, just continue to spread the word and spread awareness and help everybody continue to be comfortable, live healthy, and, stay well during these times and days. So, as I said, I'm your host, Tristan Lee, and this has been Project SCoviD. Until next time, peace out.